Good evening. Thank you so much for joining the webinar tonight. My name is Katie Hewitt, and you may all be familiar with me because I send you all of those emails that are asking you to get involved in advocacy. So that's probably where you know my name from. So I'll be leading you through the webinar tonight where we're going to talk about what's happened in Washington state with healthcare politics and really where you fit in as advocates. So just a couple of housekeeping items. This is about a 30-minute webinar, so not too long, not eaten into too much of your evening tonight. You are on mute, but that does not mean you can't ask questions. You do have a chat box, so feel free to send any questions my way. I am happy to answer them, but I'll do that at the end of the webinar. So I'm really excited to hear your questions, so think about them as we move through each slide, and I will answer them when we get to the end. And so all of that's out of the way, let's go ahead and get started. We're going to talk about how you make an impact in Washington state politics. Now, the first thing here is this first slide is for those of you who are interested in who on earth Save Healthcare in Washington is. I recognize a few names of people who are on the webinar, so I think a lot of you do know, but for those of you who aren't familiar, here's a quick description. Basically, we are a nonprofit group. We're made up of tens of thousands of people in Washington, so really you, who all want to protect and increase access to affordable health care. So you're a part of this. You're part of this grassroots, and you really power these efforts here in Washington to keep healthcare safe. Now all of these efforts are really about and led by community health centers. We call them CHCs for short. So I'm sorry if I slip into using acronyms, that's why. It's community health centers as CHCs. Anyway, the ultimate goal is to make sure that the healthcare services that they provide in their local communities stay intact. So what I'm talking about here are things like Medicaid, maternity support services, interpretive services, dental, among many, many others. Community health centers are real leaders in providing healthcare access to everyone, and that's regardless of their ability to pay. That being said, because this is a webinar about advocacy, they are really super advocates. They are always on board to make sure that their patients can speak up in Olympia. They really are the bridge between their patients and their legislators in Olympia. Not only that, but they work really hard themselves to raise awareness about healthcare issues in the legislature because legislators really trust them. So really a big round of applause for all of the CHC advocates out there who really bridge that gap between real people and policymakers in Olympia. And we'll talk about why that's so important here on the next slide. There is the old saying that all healthcare is local. So, this is sort of about the grassroots aspect of it. Each community has different needs because we're all made up of very unique individuals. And those healthcare needs cannot be addressed with a cookie cutter approach. That's one of the reasons that community health centers are just so valuable because they really approach their healthcare by looking at the needs in the community. Now, with all of that, tying that into grassroots, politics is the same. Back in the 80s, Tip O'Neill, who was the former Speaker of the House, he said, all politics is local, and it's become sort of an adage. What that means is that politicians need to address the everyday concerns of real people. They really do. Legislators want to keep their jobs, and you, their constituents and their voters, are the people who keep them in office. Now, you make decisions based on how you feel about what's happening locally, right? So legislators really need to pay attention to that. And here you have it. These are some voices of real people that made it to the legislature this past session. These are wonderful quotes from people in different communities all across Washington, really about why healthcare really matters to them. I mean, these messages, so just a little background, these messages were collected in clinics. We have an advocacy postcard program. I'm going to talk about that a little bit later in the webinar. But essentially, these are patient voices who wanted to get this message across to their legislatures, to their legislators. And so these messages went to each person's 2 representatives and their senator. They really brought the message home to the legislature in Olympia that healthcare matters to real people, to the people in their communities, the people who elect them. I mean, healthcare isn't about numbers, right? It's about our friends, it's about our neighbors, and it's about all of our Washington state families. Legislators, they have hearts and they understand what all of this means when they hear directly from the people that they represent. Remember to keep track of those questions. So now we're going to get into a little bit of what happened in Olympia in 2015, why we are where we are, and why we did what we did, advocacy-wise. So simply put, the context was that things looked really grim. The budget was absolutely a mess, and on top of that, we had a split legislature. So just to give some context about the budget, we started out with a $1 billion shortfall, and that was just to maintain the level of services that we had in 2014. So then we had to figure out how to handle this thing. It's called the McCleary decision. And so that's the decision the Supreme Court made. And it said that the state was not doing enough to keep education front and center in Washington state. Now, our Constitution says that education is the paramount duty in Washington state, and we need to fully fund education by 2018. So it's an incremental, we have to make incremental investments into education, and that meant that our legislators had to find $1.2 to $1.8 billion to fulfill that ruling. Now let's just add some more to the pile here. Voters passed Initiative 1351, which was to lower class sizes. Unfortunately, there was no funding attached to it, which meant the legislature was sitting on an additional $2 billion bill. So we were looking at a huge budget gap. Now, to complicate matters, the Senate was controlled by a group of senators who had very, very different ideas than the representatives who control the House. It was really hard to say how anything was going to get done when we had such a massive problem and two very different ways of wanting to approach that problem. So what ended up happening? Session went on and on and on. It took a very, very long time. And in fact, 176 days. That is the longest session in the entire history of Washington state. So this is what happens when you have a split legislature and a huge problem. Now see, the reason that is that states need to produce balanced budgets. There are no excuses. So the deadline to do it is the end of the fiscal year, which unlike our sort of year by year that we live in, the fiscal year ends on June 30th. So if we did not get a balanced budget by June 30th, the government was going to shut down, which meant a lot of big problems for people here in Washington. So there were long debates about how to fill this hole in the budget. And the debates were mostly about cuts versus new revenue. And we had to go into 3 extra innings. The legislature worked 3 special sessions and just barely avoided a government shutdown. But they did get there. Well, kind of. The state Supreme Court, back to the McCleary decision, recently said that we just did not end up doing enough to fund education. So what they're doing is fining the legislature $100,000 per day until they fulfill what the Supreme Court says they need to do. To put that into context, though, because $100,000 sounds like a lot of money, but all of that money is really a drop in the bucket compared to the total amount that is needed to fulfill the Supreme Court's requirement. On top of that, that money is being set aside in an account for education. So the legislature is kind of considering it a down payment. That's why the legislature is pretty likely to wait until the start of the next regular legislative session, which starts in January, to start those debates up again, rather than going into a special session. So here's a little of the nitty gritty about the budget process last year. So in mid-December, Governor Inslee really just sets the tone of how he expects the legislature to approach the budget when he does his proposal in December. Then the House and the Senate take some time to figure out what they would like to propose. Then they come together, it's called a conference budget, they come together and they debate them. So this session, both the House and the Senate released 3 total proposals each in the course of 3 months, which is very unusual. Most of the time, they're releasing 1 to 2. And so also, the next thing is to look at the bills and look at how many they passed. They passed, hundreds of bills. And then just to narrow it down, we really track the ones that have to do with healthcare. And the ones about healthcare really covered a wide range of topics. So the first one here is loan repayment. What that means is that if there are healthcare workers who go to work in CHCs, they get some help from the state to pay off their student loans, which is great news for patients who are going to get access to more docs. There were also funds that were put aside to help customer service call centers for Medicaid patients. As you know, there are a ton of more people who are on Medicaid now because of the Medicaid expansion and healthcare reform. And so they're getting a ton of calls from Medicaid enrollees, and the state really did make a commitment to help field those calls with more representatives. So that's also good news. There are also bills about children's health. Now, here's one that I really wanted to point out. I don't know if you knew this, but all health insurance plans, except for Medicaid, were required to provide autism screenings for kids. So the question was, why should kids on Medicaid be denied autism screenings? It's really just basically about equality. So that got fixed this year, and now all plans are required to provide autism screenings. Again, that's good news for Washington State kids. All right, so how did we get here? We want to talk for a second about how you helped and what are some of the tactics that we use during session to protect healthcare by really mobilizing and activating you guys, the grassroots. The first top number is 81,044. That is the total number of messages that were sent to legislators during this past session. There are 147 legislators, and so that's the grand total of numbers that went to each of them. 77,000 of those were advocacy postcards. Now, those are the postcards I referred to earlier. They are pro-healthcare messages, and we put them in community health centers across the state. The people who work in the community health centers just make sure that patients know that this is their opportunity to send a message directly to their legislators. And so we encourage people to put comments on those because, as you saw, they're very powerful and they do make a difference when they are delivered directly to a legislator's desk. We also had 2 petitions going around to support healthcare, and we got over 1,500 signatures on those 2 petitions. Now, town halls are really a unique opportunity for people to get face-to-face with their legislators. Generally, legislators hold town halls, so they're public forums where their constituents, people who live within their district, can come and listen to what their legislators' priorities are and also ask them questions publicly. So these town halls are a great opportunity to get your legislator to publicly commit to what matters to you. Ask them about healthcare issues, things like that. We had representatives from Save Healthcare in Washington, from community health centers at 15 of those town halls that all happened on March 14th. That's something to keep an eye out for. If you can get to your town hall, it's a really exciting opportunity to show how much you care about healthcare issues. Went the wrong way. So here we are. This, I think, is a great visual representation of how we are so much stronger together. It takes a lot of messages from a lot of different people, and also with a variety of stories. So really coming at them from all sides in order to get to legislators. When legislators hear the messages from all of these different people, they really start paying attention. That being said, we also have to keep legislators on their toes. We need to employ a variety of tactics to make sure that they hear our message. These are things that you can easily participate in. So do not worry. I will be in touch with you with all of these opportunities. You're really going to be a big part of whether it's rallies or phone calls, getting out to those town halls, finding postcards in your community health center, sending those emails, writing letters to the editors. Those are all things that you can easily plug into, and they really make a big difference when we're all working together to do that. So in case you're wondering about, okay, you've talked about this working, but where's the evidence? Show me the proof. So here are some quotes from legislators who had been receiving these messages over the course of the years. And these are some examples of what they've had to say. So that not only have they recognized that there are a ton of voices that are coming to them, they also recognize that there are personal stories and they really are moved by those. I can't say that enough. So legislators pay attention to you and your voices came across loud and clear. So what did that mean for us? It meant victory. We won. It was a really tough budget year. Legislators could have chosen to cut their way out of this mess, but when the end of June came, the healthcare safety net stayed safe. So working together, you really protected healthcare, and I think we can do it again, knowing what we're going to be getting into next session, which is exactly what we're getting to now. Let's just talk really quickly so I can get to some questions about what's coming up in 2016 and what it is that we're going to need to respond to, where we're going to need your help. This is it. We have a McCleary decision and we have an initiative from Tim Eyman, Initiative 1366. This is where we're going to need your help. It's really hard to say what's going to happen in January when legislative session starts. The legislature has already written its 2015 to 2017 budget. So what that does is it makes this a supplemental budget year. So they're really just going to be making tweaks to the work that they've already done. But if the revenue forecasts say we have more money, we have less money, there are more caseloads, there are all these different factors that the legislature will have to work with in order to keep that budget balanced. Now, to make it a little bit tougher, we've got the McCleary decision looming over us that we already talked about. There's also this initiative that Eyman has on the ballot this year, and it could mean a lot of problems for Washington. Essentially what it means is that if the initiative passes, legislators either have to amend the Constitution so that 2/3 of a vote would be needed to change the budget structure, so to either raise revenue or to close loopholes. If the legislature does not do that, then they would face essentially $8 billion in unnecessary cuts over 6 years. I don't want to get too detailed about this right now, so look for emails about this from us leading up to the elections. I'm really going to be able to send out more information and give you more of an opportunity to learn about what's happening with this initiative and what it would mean for Washington State. So all of this is to say that while the specific issues that we're going to have to fight for really do remain murky, we don't have a clear sense of that. What is clear is the context. No matter what, there are going to be plenty of opportunities for you to speak up for healthcare. We're going to make sure you know about them immediately. We're going to ask you to send emails, sign those petitions, and a big one is really to tell your friends, because like we saw, together we really are louder. I have received a couple of questions throughout this, so that's great. Thank you so much. The first question here comes from Derek, and what he says is, you said that it's really important to write personal comments to my legislators. So what kinds of comments should I write when I contact them? That is a really good question, and I should have mentioned something about that. What really moves legislators is your personal experience. So when you're able to say, to relate how a healthcare policy or a cut, whatever, how it would impact you in your life, that's what they're going to pay attention to. Like I said, we can talk about the numbers. The numbers are important, but what our job as grassroots advocates, as the people on the ground really speaking up for healthcare, we need to bring them the experiences and the stories from the people that they represent. So I hope that answered your question, Derek. Moving on, we have a question from Eileen who says, the state's economy is doing better, so why don't we have enough money to fund education? That is such a great question. I'm sure you've heard that the economy is doing better. We're creating more jobs. Just the other day, there was the revenue forecast, which said that the state has more funds than it had expected. The fact is that it's not enough. It's great to see the economy growing, but we're still pulling ourselves out of the recession. So there's still a lot of work to do to make sure that we're back where we need to be able to fund the things that really matter to Washingtonians. The things that we value need to be funded, and we frankly just don't have the funds to do that quite yet. Wait here just a second to see if any other questions come in. Don't be shy. I'm here all night. Oh, here's a good one. So this says, when will I see the cards in my clinic? So this hi, welcome. I'm glad that you're here. You must be a CHC staff member. And that's a great question. So we're going to launch the clinic card program in the second week of December. So that's when you can start seeing cards in your clinic to give to patients, and as patients, that's your chance to start looking for those cards so that you can sign them and send a message directly to your legislator. Now, like I said before, legislative session does not start until the middle of January. But we want to send a strong message on that very first day that healthcare should be a top priority. So what we do is we start collecting these messages, and then they get sent over to our office here. We sort those and do data entry on those so that we can really track them and make sure that they go to the right legislator. So they don't go to every single legislator in Olympia. They just go to your representatives and senator. So I hope that's helpful. That's going to be mid-December, and that's why really make a push at the beginning of the program. Okay. I think we're getting to half. Oh, here comes another question. So is there an action coming up that we should be looking out for? Okay, so yes, that is the short answer is yes. And like I said, like I talked about earlier, the McCleary decision is causing a problem for the state, but Iman's initiative, Initiative 1366, could make that a real challenge. And so I'm going to be sending out emails with some more education about what that means, and then ask you to take a pledge, ask you to take action, tell your friends, make sure that everybody knows what is happening if this initiative passes. So definitely keep an eye out for emails from me before the November election. And I have a follow-up question. So how do I spread the word about SAVE if my friends don't go to a community health center or aren't signed up? So Great question. Here is where our website comes in. We have a tool. If you go to savehealthcareinwa.org, it's up on the upper left-hand corner of this slide. So it's savehealthcareinwa.org. There's a tell a friend button, and you can actually enter up to 20 email addresses of your friends and family members, community members, anybody that you'd like to get involved in Safe Healthcare in Washington. You can also just direct questions directly to me. You'll get emails from me thanking you for attending the webinar. So go ahead and get onto the website. Share Safe Healthcare in Washington with your friends, because you are the best messenger. I can send emails to people and say, hey, I'm a perfect stranger. Would you like to get involved in Safe Healthcare in Washington? It just isn't the same as the message coming from you as a trusted member of their community. Okay. Just a couple more seconds for questions. We're getting to the end of our time. Oh, and just so you know, the webinar is being recorded, and I will post it on our website as soon as I figure out the technology. So do keep an eye for that. That's another thing you can let your friends know about. Great. Well, thank you so much for spending your evening and asking such great questions, spending your evening with me as we went through why the grassroots matters and what's happening in Washington State. I really, really appreciate your time, but even my appreciation gets even larger when we start talking about what you do as advocates to get this message to Olympia that healthcare really needs to be protected here in Washington State. So with that, I will give you your evenings back, and I'll be in touch. Thank you.